Good evening, my dear students, all OET aspirants. Welcome to our 46th live session. So it's me, Abhilash Vijay Mohanan Nair, the senior faculty member from B-GHUD Academy. I welcome once again all of you to this virtual platform for yet another interesting role-play session, OET Speaking. Okay, so come and enjoy all these role plays. Enjoy in the sense you can learn the things and put it into practice so that you'll be getting excellent score for OET Speaking. Okay, once again, welcome. I hope all are doing good and fine. Okay, see, this question that we have given here today, it has not got its setting. So I want all of you to write it as setting as post-operative unit. Okay, or post-operative or pre-operative unit. Okay, write it as like a pre-operative unit or pre-operative wards. You can add like that. Okay, yes. So now I'm not going to waste any time because it's not wasting time. There are no much discussion for us. There are no other questions given to us. There are no other queries so far. So I would like to step into our question discussion directly. Okay, so let's not take much time. We'll straight away go role play setting is pre-operative unit. Okay, you have been advised by GP to run pre-operative assessment on Mr. Henry, a 73-year-old patient has been scheduled for left inguinal hernia surgery. Okay, you notice him to be a bit worried. Fine. Begin with warm greetings and reason for your visit. Check whether he had followed the instructions given by the doctor. That means, what is the instruction? No eating or drinking after midnight. The night surgery. That means NPO from yesterday. That is what. So this is a non-case. Left inguinal surgery has been scheduled. So now making the patient to take a preoperative assessment. Okay. We are doing a preoperative assessment as per doctor's instructions. It seems the patient is quite worried. So you need to catch that. Patient will never say like I'm worried, but it is given like the patient is quite worried. So you need to catch that. That shows our observation, and it is a must to reply for that. Just facial grimaces, non-verbal talk, looks worried, seems tensed. Okay, all those things. Fine. Begin with warm greeting, explain the reason. Check whether he had followed the instructions, previous instruction. That means NPO. Whether he had followed NPO from yesterday, that we need to confirm. Okay. Address his concerns. What all his concerns we should ask. In that he can be discharged within 48 hours. Okay, so the question is given there. 48 hours only it will take for discharge, no other complications. It will be mentioned before and after surgery. Okay, so be informed, he will be monitored before and after surgery. So we have to tell that strict monitoring will be there before and after surgery. Fine. When patient arises, there will be discharge only after 48 hours. Okay, all the stability and all clear should be there. Fine. Next is like address is when the patient arises concern of aftercare and recovery, explain how to take care of himself. First, regarding post-operative care and all, the patient would be anxiously asking something. We need to clarify all their concerns, like adequate rest, return from strenuous, refrain from strenuous activities. That means stay away. Refrain means abstain, stay away. Any physical labor, do gentle exercises. Okay, avoid sedentary lifestyle. Means, healthy. Look out for any infection. Okay, most likely to return light activity in 1 to 3 weeks. So the patient could initiate some sort of light activities after 1 to 3 weeks of surgery. Tell him that he still can be independent. We can assure them that they can stay independently because following the instructions the doctors advised to discontinue. Okay, so further orders be consulted once more. Once more, you can get consulted by a doctor, and in case any unwanted treatment measures have been given, we can ask them to avoid that. Okay, ask whether he is ready for procedure and continue with pre-operative preparation. So we are here to do some pre-operative assessment. So it is our duty to confirm whether they have followed all the instructions and that they are ready for this pre-operative preparations. That's all regarding the topic. I hope the question is clear. Any doubts? Good evening, my dear Bonnie. So I was waiting for you. Always Bonnie will be giving me some sort of encouragement by throwing some good morning wishes and all. Okay. Thank you, Bonnie. God bless you. And those all others who are watching me, just put your comments over there. Okay. You can pin your suggestions over there in the comment box. I'm always ready to help you. Okay. So I think the setting is everything, setting, situation, scenario, task, everything is clear. So now we'll start. Okay, if you have got any questions or if you have got any queries, please do send it to me. Okay. Yes. So no one is having any sort of Let us move into question discussion. So this is a known case, schedule for surgery, all the things are set. We are just starting the conversation as a known case. Okay. Mr. Mr. We can from Martin we can take a break. Okay, Mr. Tom. Good morning. I'm your nurse today. Okay, my name is Dash. I'm your nurse here today. Okay, Mr. Tom. Good morning. So first itself we are addressing the patient by name. Mr. Tom. Good morning. I'm your nurse here. Well, how are you feeling? Are you all set for surgery? Are you all set for surgery? Okay. See, the doctor has asked me to continue a preoperative assessment for you. Shall I go ahead? Are you okay? See, the doctor has advised me to conduct a preoperative assessment for you. Okay. Okay. Are you ready? Okay. So we can just asking like, are you ready? So the patient will be saying like, okay, nurse, I'm ready. Well, please tell me how about your food and fluid intake? Hope you are on NPO since yesterday. Hope you are on NPO since yesterday night. Hope you are on NPO, nil per oral, since yesterday. Okay, have you had any food or fluid in midst? Have you had any food or fluid in midst? Have you had any fluid or food in midst? Okay. So the patient would be answering to all these questions. And that means that everything will be instructed in detail. So whatever the questions we are asking, they will be responding to in such a manner. Okay. Address his concerns. Inform him that he can be discharged with that. So the patient would be asking about now. So I'm really very worried. How long does it take for my complete recovery? When I can go home? All those things. I understand. I know you're very concerned. See, as I mentioned, please don't worry. Okay. Most probably the discharge may take 48 hours after surgery. Most probably the discharge may take 48 hours after surgery. Okay. If there are no complications, mostly it will take 48 hours for the discharge from from OT recovery. Okay. So we can like that. It may take nearly um, what 48 hours for you to have discharge. It may take nearly 48 hours for you to have discharge. Okay, if there is no complication, okay, if there is no complication, your vital signs, your physical examination, everything will be done. And once the doctor give all clear, once the surgeon give all clear, you will be definitely sent back home. Once the doctor give all clear, you will be definitely sent back home. Okay. Solved. He will be monitored before and after surgery. So we have to tell them that. See, Mr. Martin, it is take some time because before and after surgery, it is a must to do clinical examination and observation. It is a very must to do clinical examinations and observations. Okay, so that we will be able to detect any other problem. So that we will be able to detect any other problem and can act accordingly. And can act accordingly. Okay, and can act accordingly. Hope you're getting me. Any other queries? So they will be asking like very much worried about aftercare, money and all this. Okay. Well, I understand. I know you are very much very concerned. It is usual among people of your situation. First and foremost, I would like to explain you something regarding your rest activities. Okay, make sure that once after the surgery you are taking complete rest. Okay, make sure that you are taking complete rest following the surgery. It is very much important. Okay. Okay, adequate rest is a must first choice when you have to consider when it comes to post surgery. Fine, and once more, it indeed very important to refrain from strenuous activities. It is very important to refrain from strenuous activities. Never go for any outdoor excessive activities. You can minimize all your exercises and other physical activities that causes exertion and physical labor. Okay. You can try some gentle exercises. You can try some exercises like simple flexion extension once you can try so that it will improve blood flow and it will promote your healing. Okay, most importantly, I would like to stress onto the importance of sedentary lifestyle. It is high time you modify your lifestyle. It is high time you modify your lifestyle. Okay, make sure that you're taking a healthy, well balanced diet. Okay, and medication should be continued till the doctor's visit. Okay, and what else you can say, like, okay, make sure that the wound area is clean, neat and dry. All those things you have to take a great care of. Okay, all the things that you have to take care of. and close monitoring of wound. I stress it once more. Okay. Wound care. Okay, I would like to stress the importance of wound care. I would like to explain you regarding the wound care. Yes, it is very important to take care of wound. Always do have a close watch. In case you observe some redness, swelling, or oozing, in case if you observe some redness, swelling, or oozing, okay, pus, exudates, or debris, never delay. You can come back to the doctor because that would be a warning sign of infection. Okay, because that would be a warning sign of infection. Okay. And avoid physical labor that causes exertion. Avoid physical labor that causes exertion. Okay. Do gentle activities as mentioned. Avoid sedentary lifestyle. So we have just already discussed all those things. Okay. Taking always ensure a balance between rest and activities, and at the same time never go for any strenuous vigorous activities. Okay, you can take some simple activities, exercises, flexion, extension, all can, but it should be done properly. Yes. And monitor for any signs of infection. Usually it is not likely to return. Usually it is not likely to return, and generally takes 3 weeks for complete recovery. Okay, and generally it takes 1 to 3 weeks for complete recovery, and generally takes 1 to 3 weeks for complete recovery. Are you getting me? Are you getting me? Hope you're confident now. Will you be able to manage things? Okay. Do you have any other questions for me? So finally the patient will be asking like, I want to be independent. The patient will be saying like, I want to be independent. Means their freedom. Okay. We can ask like, who do you stay with? Who is there to assist you at home? Okay. So they will answering the question. They are staying alone. They are want an independence. They don't have. Do you wish to take some assistive services? Do you wish to take some assistive services? I mean, some carer or uh, or some bystanders that you wish to have. So they will be saying like, I always value my independence. I don't want anyone to support me. I'll take care of myself. That's great. I'm really very proud of you. So if you don't mind, can I get you? Okay, if you don't mind, uh, can you explain me what else is bothering you? Explain me what is bothering you. Okay, you don't have to worry at all because you can still continue an independent life. You are in no way likely to have a dependence on this um, what others, dependence on others. You are no way you are no way in you are not at all likely to be in independence here after surgery. Okay, you can just perform all your activities by self. You can perform all your activities by self even after the surgery is done. Okay, like what you need to do is like you need to follow the doctor's instructions. You need strictly follow the doctor's instructions. Okay, um, you need to strictly follow doctor's instructions. That is paramount. That is paramount or imperative, we can say. Like, yes. Once the doctor says that you're fit and stable, once the doctor says that you're fit and stable, definitely you will be able to go back home. Once the doctor says you're fit and stable enough, you can definitely go back home. You can definitely go back home. Okay. So, and your discharge decision will be subjected to the doctor. It may take nearly 48 hours. It may take nearly 48 hours. The yeah, the doctor is the right person to take an authority. Doctor is the right person to take an authority, and the decision will be subjected by evaluating and assessing your progress and your level of improvement. All right. So they will be saying like, yes, nurse. Okay. Any is there anything else that you would like to ask? Okay. So the patient will be saying like, no, nurse, it was really a pleasure meeting you, nurse. All those things. Okay, it was really very happy talking to you. Thank you for explaining me all these things. They will be saying. Okay, and finally the task is like, well, how do you feel now? Are you confident enough to manage things? Okay, will you be able to manage things by yourself? Are you okay? Are you ready? Hope you have got all the information. So I hope all your concerns are assuaged. So they will be asking about independence and all. Okay. Okay, so they will be asking about that they will be asking about further things and all. Okay, so once after the surgery, more instructions and information will be given at the time of discharge. Okay, even after the surgery, you are in no way likely to be dependent on others. You can perform all your activities by yourself. Soon you will regain independence. Okay, ask whether he is ready for procedure. Okay, I hope you're confident now. All your concerns are assuaged. Now, if you permit, shall I move ahead with the formalities for operation condition? Okay. Operation procedure. Are you ready for the operation procedure? Shall I convey your willingness with the doctor, or convey the willingness to the doctor? So they'll be saying like, definitely you can convey, I'm ready for the procedure. That's great. So we have to compliment the patient like, that's great. You will be definitely all right for sure if you go for taking this. If you take this instructions as advice, you will be definitely all right for sure if you take these instructions as advised. Okay, more instructions and information will be given at the time of discharge before you are after your procedure. So, in case of any queries, any concerns, feel free to ask. Um, I'm all the time. I'm ready to clarify all your concerns for you. Okay, so take care, all of you. Read peaceful. I hope everything is clear with you. Any sort of concerns or any suggestions or any points, if you want me, please do send me these messages. You could put it in your comment box, or the other way you can just contact me. Okay, so now it's time to end up the role play session. So 47 also next week. Till then, take care all of you. Bye. Read well, practice well. God bless you all.